Okay, so today I'm going to be doing NG tube medication administration. So my two medications are fluconazole, which is a systemic antifungal. What it's going to do is inhibit the synthesis of the fungus, and it's going to hopefully kill the susceptible organism. So some precautions that we could take with this would be the hypersensitivity and people with renal impairment and heart disease. So some complications that could arise are headache, dizziness, and seizures. And my next medication is lansoprazole, which is a proton pump inhibitor. So it is going to bind to an enzyme in the presence of acidic gastric pH, preventing the transport of hydrogen ions into the gastric lumen. So it's going to decrease the accumulation of acid lumen in the stomach. So some complications that can happen are dizziness and headache and diarrhea. Some precautions would be the hypersensitivity and hepatic impairment. So first I'm going to go to my medication administration record and my provider's orders, and I'm just going to make sure everything matches. So Stan Checketts, date of birth 2/26/1966, and Lanzaprol 30 milligrams via the NG tube, and fluconazole 400 milligrams via the NG tube. So everything matches between the doctor's orders and the medication administration record. So now I'm just going to go ahead and check the allergies, and according to the MAR, there is no allergies for Mr. Checketts. So next thing I'm going to do is I'm going to put on hand sanitizer, and I'm going to gather my supplies. So we have 2 pairs of clean gloves, my 5 cups for the water and the medication, my pH testing strips, water, apple juice, and my syringe. Now that I have my medication, my supplies gathered, I'm going to wash my hands again, and I'm going to enter the patient's room. So I'm going to knock, and as I'm entering, I'm going to assess the scene for safety, and nothing seems unsafe to me. So I'm going to ask him his name and date of birth, and it's Stan Checketts and his date of birth. And do you have any allergies? And he said no. So what I'm going to do now is place the client into a high Fowler's position. So I would just sit him up so I could administer the medication there. And then I'm going to go ahead and put on hand sanitizer again, and put on my first pair of clean gloves. Okay, so then I am going to check the NG tube to make sure that it is in the stomach. So what I'm going to do is pull up 2 milliliters of air, and I'm going to listen to his stomach as I push the air through the NG tube. So I would just listen, and I'm going to push the air through, and I do hear a whooshing sound. So that ensures that the placement, but just to make sure, I'm also going to withdraw some of the stomach fluid. So I take the NG tube and withdraw. So I have I have 20 milliliters of yellow biliary fluid, and I'm going to test the pH of it with a pH strip. And the pH is at a 3, so that does ensure that the nasogastric tube is in the stomach. So after that, I'm going to go ahead and take off my clean gloves and wash my hands again. At this point, I can go ahead and get my medication. So I have diflucan, or the fluconazole, and the Lanzaprol, which would be in a pill form that I would have to crush up, and the fluconazole is in a liquid form. So it comes, the fluconazole comes in 40 milligrams per 1 milliliter, and we need 400 milligrams, so I would have to pour 10 milliliters of this into his medication cup. So now that I have this, I can do the 5 rights. So for my lansoprazole, it is the right medication. It's 30 milligrams, the right dose. It's going to go through the NG tube, that's the right route. It's 10 o'clock, and the time that the medication needs to be administered is for 10 o'clock, and it is for Mr. Stan Checketts. So that was the 5 rights for that one. And same thing with the fluconazole. So it's 400 milligrams, the right medication, the right dose, the right route, the right time, and the right person. So now that I have the medication, I am going to wash my hands again, and I'm going to put on my second pair of clean gloves. And now that I'm at the patient's bedside, I'm going to do the second medication check. So I would look at the MAR and I would match it to the medication, and it is correct. So now I'm going to take my water and I'm going to pour 20 milliliters of water into each of these 3 cups. So 20 milliliters in each. And I am going to dissolve the 30 milligrams of lansoprazole into 30 milliliters of apple juice. So I would pour the medication in the cup and then dissolve it with 30 milliliters of apple juice. And then I have the fluconazole, and I'm going to pour 10 milliliters of the fluconazole in its liquid form, so that would equal 400 milligrams. So now that I have that done, I can go ahead and I'm going to start, I'm going to do the third medication check at the bedside again, and it is the correct medication. So now I'm going to take my syringe, drop 20 milliliters of water, and I'm going to insert with gravity 20 milliliters of the water. And then I'm going to grab the fluconazole and draw that up. And then I'm going to insert it gravity flow through the NG tube. Then I'm going to draw up another 20 milliliters of water and insert that to the NG tube. And then I'm going to draw up the lansoprazole in the apple juice, draw that up, and I'm going to insert it through the NG tube. And then I'm going to do my last 20 milliliters of water, and I'm going to insert it into the NG tube. So after that, I would just assess the patient and make sure that they're okay, they're breathing, they're sitting up, he's responsive, he's talking. So then I would go ahead and take off my gloves, and I would wash my hands, and then I would come over to the medication administration record, and I would just verify. I would write my initials next to the lansoprazole and the fluconazole, and then I would sign my name at the bottom. After that, I'm going to go ahead and do the input and output. So I had 30 milliliters of apple juice, the 10 milliliters of the fluconazole, and 60 milliliters of water. So I would come over, it's 10 o'clock, I would come over, and I would write 100 milliliters at 10 o'clock for my intake. That's it.